Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. And today's show is called Dr. Jeffrey Tauth, Icky Sleep Apnea's Hidden Heart Attack Risk. And trust me, it's juicier than your cousin's peach cobbler. Did you know that poor sleep could be silently damaging your heart right now? I'm talking about right this very minute. While you're listening to this podcast, your heart could be paying the price for what happened last night in your bedroom. And no, I'm not talking about your Netflix binge. I'm talking about sleep apnea, the sneaky little troublemaker that's probably the most underdiagnosed threat to your ticker. Now, let me paint you a picture of what's happening inside your body when you have sleep apnea. Imagine your heart is like that friend we all have who's always picking up everyone else's slack at work. When you stop breathing during the night, and yeah, that's exactly what sleep apnea does, your oxygen levels drop faster than your energy after Thanksgiving dinner. Your poor heart is sitting there going, well, somebody's got to keep this party going. So it starts working overtime, pumping harder and faster to get whatever oxygen is left to your brain and organs. This isn't a once-in-a-while thing, folks. We're talking about your heart pulling double shifts every single night, sometimes hundreds of times per night. Yep, entirely true. I can't make this stuff up. It's like forcing your heart to run a marathon while you're supposedly resting. No wonder it leads to high blood pressure and irregular heart rhythms. Your heart is literally having a panic attack while you're dreaming about winning the lottery. So what are the warning signs that your heart is sending out an SOS signal? First up, loud snoring followed by those eerie silent pauses. If your partner has ever nudged you awake because you sounded like a freight train that suddenly derailed into silence, that's your first clue. Then there's waking up gasping or choking like you just surfaced from the deep end of a pool. And those morning headaches paired with feeling like you got hit by a truck despite being in bed for 8 hours? Your heart is basically leaving you a strongly worded note that says, "We need to talk." Let me tell you about Sarah, one of my patients who thought she was just a heavy sleeper with a snoring problem. This 45-year-old teacher figured her exhaustion was just part of the job. I mean, have you seen what teachers deal with these days? But when her husband started sleeping in the guest room because he was terrified watching her stop breathing at night, she finally came to see me. Her sleep study results: she was stopping breathing 40 times every hour. 40 times! That's like playing a deadly game of red light, green light with her oxygen supply all night long. Within months of getting her CPAP machine and actually using it, and that's the key, folks, you've got to actually use the thing, Sarah's blood pressure normalized, her energy came roaring back, and her husband moved back into their bedroom. Win-win-win. Now here's where the numbers get scarier than a horror movie marathon. Untreated sleep apnea doubles your risk of heart attack. Doubles it. It's like playing Russian roulette with your coronary arteries. The stroke risk? That jumps up by 3 to 4 times compared to people who sleep like babies. And get this, 80% of people with treatment-resistant high blood pressure have sleep apnea. That means if your blood pressure medication isn't working like it should, maybe I should see you in the clinic. We need to talk. But here's the beautiful plot twist in this medical drama. Treatment can reverse much of this damage. Your heart is incredibly forgiving when you give it the chance to heal. It's like that friend who's always willing to give you another shot after you've messed up. Except in this case, the makeup gift is proper oxygen levels and actual rest. The takeaway is simpler than my grandmother's cornbread recipe. If you're snoring loud enough to wake the neighbors, or if you're dragging yourself through the day despite getting what should be plenty of sleep, march yourself to your doctor and ask about a sleep study. Don't wait until your heart decides to file a formal complaint in the form of a cardiac event. Sleep apnea isn't just about being tired, it's about your heart crying for help while you're unconscious. Early detection and treatment can literally save your heart, and honestly, it might just save your marriage too when your partner can finally get some peace and quiet at night. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.